everybody. I'm Brian Malow, and this is But Seriously. From almost the very beginning of the pandemic, the COVID-19 pandemic, which is already 2 full years now, I'm sure we all had all kinds of thoughts. We were confused about everything. We weren't sure. It seems that along the way there were some communication misfires, if not something deeper than just communication. But I think from the very beginning, I started imagining if this virus is in the air to any extent, that beyond hand washing and beyond scrubbing things that come into our house or disinfecting surfaces and maintaining 6 feet distance, I very early on started imagining that we would probably see architectural changes in public spaces. That if you're at a restaurant, couldn't they do something with the airflow so that it went up or down? I didn't know which is better because I'm a comedian, I'm not a scientist. But for almost 2 years now, I've been reading the press, and there's one name that I kept seeing for 2 years. I kept seeing this name, Linsey Marr. She was quoted in almost every article in the New York Times, in the Washington Post, everywhere. I kept seeing her name, and she was an environmental engineer and commenting on how the virus behaves in the air. So this was the kind of person that I needed to ask my questions to. And the whole time I thought, though, that it could probably be a very scary interview, but here she is 2 years later. I finally asked her, and she was all too happy to join us and talk to us. So Linsey, thank you so much for being here.
Hey, it's great to be here. Thanks for inviting me to join you.
Yeah, so you are, let me give you a proper introduction, and including your background, because you're not a virologist and you're not an epidemiologist. You're an engineer. You did your undergrad work at Harvard in engineering science, got your PhD at UC Berkeley in civil and environmental engineering, which I'll ask you to define for us. And now you are a professor of civil and environmental engineering at Virginia Tech. You teach courses on air pollution and environmental engineering, and you lead the Applied Interdisciplinary Research in Air Laboratory. Why don't we start right there? What is this Air 2 laboratory? What is your lab over at Virginia Tech?
I lead a group of students and postdoctoral fellows who study things in the air and how they might affect our health. We're really motivated by public health and trying to figure out, okay, look at these questions and problems about what we're breathing in the air and how to improve it, how to improve our health. And we use, just to address the interdisciplinary part of it, is that we use all available tools of science and engineering. I don't limit myself to environmental engineering or just aerosol science, because really I see it's all connected. It's the same physical, chemical, and biological principles that underlie everything.
Excellent. So you're an environmental engineer. What do you mean by interdisciplinary then? Who are some of what are the other disciplines?
So I collaborate extensively. So, I have my expertise about how things move around in the air, how they're emitted, how much is emitted, what happens to them. But we collaborate broadly with people who are in public health. We collaborate with virologists, mechanical engineers to understand materials and filtration. We collaborate with geoscientists to understand small particles that are moving around in the atmosphere and elsewhere in the environment. I've collaborated with social scientists and historians to better understand the background of kind of how did we get to where we are now with our scientific understanding. Chemists, you name it. I'd like to collaborate with lots of different people in different fields.
Excellent. And let's go back a little I want to know a little bit more about your background. I like what you told me about how your area of expertise is in the movement of, what would you say, particles or in the air and in our environments. And your expertise is not in the medical effects.
Absolutely. I study particles in the air. I first got it started looking at emissions from cars and trucks. because I'd go running when I was in college, and I'd be running alongside busy highways, breathing in all this exhaust and wondering, oh my gosh, what am I doing to my lungs? Is this run actually a net, is it not a benefit for my health, but actually a detriment for it?
Ooh.
And then we started studying engineered nanoparticles, things that are made intentionally manufactured to be very small that could get into the air that we could end up breathing in. And ultimately, we've been studying viruses in the air. And really, my understanding starts from when that is released into the air in your respiratory tract to how it's moving through the air. And then finally, does it reach someone else, and do they breathe it in? Once they breathe it in, and if it then deposits in their respiratory tract, that's where my understanding ends. What is happening in the body with it, that is in the field of medicine.
Your responsibility ends somewhere between the mask and that little space right there between the mask and entering my body.
Exactly. Well, I can talk about what happens with it as it's being trapped by the mask, or if it gets through the mask and you breathe it in, and does it end up depositing or kind of sticking inside your nose, or more deeper in the back of your mouth, or maybe down deep in your lungs. But once it settles onto these inner surfaces of your respiratory tract, I'm done.
So, what were you really working on? So, since the pandemic hit, your lab's focus, like so many labs in virology and every other part of it, so many labs turned their focus to. I know virologists that were working on other respiratory viruses, and they just turned to COVID 2 years ago. So 2 years ago, and beyond 2 years ago, what were you working on before the pandemic?
Before the pandemic, my lab was working mainly on transmission of the flu and trying to understand, how what size particles it's in, and how much transmission happens by breathing it in versus being close to someone and being sprayed by their large droplets, and especially how the virus survives when it's out there floating around in the air or sitting on surfaces. We've also been studying, for example, how humidity affects that, because we think that might play a role in some of the seasonality of the flu. So this is something that my lab has studied for a long time, for over 10 years. And it was very easy for us to pivot to looking at COVID-19 when that happened, because from our point of view, whether it's the flu virus or the SARS-CoV-2, it's really just this small particle. It's about the same size, it moves through the air in the same way. That's all determined by the size of the particles that's carrying it. And then there are, of course, differences in survival that we've been exploring.
Right. So I do want to say I will be open to your comments if any viewers want to send anything in. Elizabeth Erickson says good afternoon, and thank you, Elizabeth. And someone says thanks for all you're doing. I'm starting to see recommendations for small portable HEPA fans and suggesting if blow filtered air into my face, I'll be safer in a bar or cafe. Yes or may. You know what though? I just wanted to acknowledge this comment, but it's a subject that I kind of want to build up to. I don't want to go there quite yet, but we're going to be talking in depth about masks and other types of mitigations and architecture and airflow. So there's so much. I just want to build up a little foundation. In addition to your research, you've served in advisory roles to the national with the national academies, and in your role as a fellow of the International Society of Indoor Air Quality and Climate. And I know that that you've not only given some 500 interviews in the media the past couple of years, but you've done a lot of speaking to government entities and advising. So I guess this past week, we saw this article come out in Nature magazine. It says why the WHO took 2 years to say COVID is airborne. So I'm pretty sure from the beginning, you and your colleagues have been telling us that it's airborne. I guess that all of us don't have a firm idea of what we mean, like if we really need to define the term airborne, aerosol, aerosolized. But have we been doing it wrong for 2 years?
I think we've muddled our way there over the past 2 years. I think for the general public, airborne means something in the air. And so if it's not waterborne, it's not bloodborne, it's not foodborne, it's in the air. And so that's that's how we should describe it. You can breathe it in, it moves around in the air. Um, to the medical community, though, the word airborne has a very specific meaning, which means transmission at long distance and requires N95s and negative pressure rooms in hospitals. And early on, they didn't see that or they didn't realize that was happening, and so they kind of really resisted saying, "Okay, the disease is airborne."
Hmm. So that's interesting. That like what would differentiate that the level that would require those kind of mitigations of the pressurized rooms and everything? Yeah, I'm having trouble seeing the difference that they're maintaining there.
I think part of it is due to, the kind of the textbook understanding of how viruses were transmitted was not quite right. It was kind of like, well, diseases could be transmitted either by these large droplets that spray into someone else's face when you cough or sneeze on them. They don't travel more than 6 feet, and that's it. Or diseases were transmitted by tiny particles called aerosols that are really only generated under special circumstances and that travel far and really infect others mainly at a distance. And so it was really this either or, and the
Yeah.
by default, these respiratory diseases have always been assumed to be spread by large droplets unless proven otherwise. And unless proven otherwise was kind of the special exception for things like measles and tuberculosis.
So did you see what's the oh, I forgot the big Netflix movie that just came out about the denial of the asteroid.
Oh,
What's
yeah,
it?
yeah.
Don't Look Up.
Don't Look Up. I did watch
Did you
that.
see that
Right.
movie? Did you resonate with this? I feel like this it could be every science fiction film, every disaster film from the beginning of the pandemic. I've also wondered, it's like, come on, if this were we know we're supposed to listen to the scientists. Why don't we listen to the scientists? Did you and your colleagues who study aerosols feel like you were screaming into a vacuum, that you knew something and people weren't listening to you?
Yes, it felt like a bit like beating our heads against the wall. There was not only scientific misunderstanding, I think, but there was also an agenda of, of the shortage, really, of protective equipment for healthcare workers, the shortage of N95s, which I think was driving some of the messaging early on.
Right. I know these are complicated issues, uh, but that resulted in a problem with trust in science or trust in the government, and maybe it's even hard to separate those two sometimes. Um, when when we found that out, I'm not sure if you have anything more to say about that. Like, was that a mistake?
I think it was a mistake early on to um, say that masks were ineffective, because what they really should have said was, we don't have enough. Once we have enough, then we should we use masks because they can help reduce transmission.
Right. They could have emphasized distance and other things, and maybe explain that to us. But there really wasn't. So it's not as nefarious as maybe I'm making it sound, because the WHO, they weren't purposely trying to or the CDC or the White House or none of these entities were purposely trying to create a situation that would result in more harm than good. But maybe they were working on bad information. So why did it take so long for us to understand that? I mean, to me, it seems like viruses are so incredibly small, even compared to bacteria. We're talking about something so small, like Why wouldn't it just be floating in the air? Why aren't all viruses floating in the air? Are they? Aren't they?
Yeah, it's likely that all the respiratory viruses are floating in the air and transmit in a similar way as does COVID-19, maybe to a different extent, some more so, some less so. But, again, it comes back to this misunderstanding of the idea of what diseases are either transmitted by large droplets or they're transmitted by tiny aerosols. And there was no allowance for overlap between those two. And I think what was missing was an understanding that, well, when people cough or sneeze or even talk, yes, they could be spraying out these large droplets. And for every large droplet that comes out of their mouth, there are hundreds of tiny droplets that we call aerosol particles, or just aerosols for short, and that those can indeed carry the virus or other pathogen, and that the virus does survive in those, and that it travels like cigarette smoke particles farther than 6 feet away, and that when you're close to someone, yes, you are within range of their large droplets that are sprayed, and you are also in the more concentrated part of their, let's say, plume or jet of respiratory aerosols that they're emitting. Just like if you are close to a cigarette smoker, you are going to be exposed to more of that smoke. And if you move farther away, it's more diluted, but it's still there.
Yeah. So one thing I want to one thing I feel like that's been missing, that even as much science news as I consume, um, there's I don't know much about how we know these things, and I'm fascinated by that, and I think some of our viewers would be about how we know these things. So I'm going to want to hear about some of the experiments that your lab has done and experiments that other labs have done that you're familiar with. So this is all very like it's because it's how can we even determine these things when we're talking about something? Does a virus actually have to be attached to a particle, large or small? Does it have to be attached to a particle at all?
It is, in fact. And to address the earlier part of your question, I think it is hard for us to think about these things because we can't see it. And so there are special tools that we use in the laboratory in order to measure these things, to collect samples of them and show that they're there. But yeah, they replicate in our respiratory, certain types of viruses replicate in our respiratory tract, and then they don't they don't just kind of pop out naked from the respiratory tract into the air. They are sitting there and kind of in cells that have burst open. They're sitting there in the fluid that's lining our respiratory tract. And whether you're infected or not, you generate these droplets and aerosols when you breathe, talk, cough, speak, sing. And if you happen to be infected, the viruses might be carried in these droplets, tiny droplets of and aerosols of respiratory fluid. And those droplets can range in size from, way smaller than we can see to large visible ones. And when they get out into the air, they're going to, under most conditions, they'll evaporate. Some of the water will evaporate, and that leaves behind things that are in our respiratory fluid that don't evaporate. And those are things like salts, like sodium chloride, right? Because we know that our sweat, for example, is a little salty. Well, our saliva and respiratory fluid is like that too. There's also proteins in there and other chemicals, kind of the slimy stuff. You think of your mucus. It's not just water. And so even if the water does evaporate, you're still left behind with this goo, and the virus might be in there. And so that after it comes out in all different sizes. Some of the water evaporates. What you have left is all different sizes of particles, and the size of that particle is what determines how it's going to move around in the air.
Right. So tell me about how you got into this. You told me a story of how observations you made in your personal life and the lives of your children that put you on the path to. I think at the time you were maybe studying other pollutants. You hadn't switched over to biological things like the flu. What put you on the path?
Right. So I had been studying particles in the air, things from like cars and trucks, and then we were looking at engineered nanoparticles that are made for making thin, flexible solar cells, made for other purposes, and during the manufacture or use of these, they might be released into the air. And then had a kid, my first kid, 14 years ago, and then maybe a few months after he was born, he started in daycare, and then like all kids who go to daycare, he got sick a lot. And so on average, every other week, we get the phone call of your kid is sick, please come pick him up. And so then he'd be at home. Sometimes I would get sick too, and I couldn't go to work that day, had to cancel all the appointments, and the next day too. And this just happened over and over and over again. And I knew that the childcare center was very fastidious about hand washing, wiping down surfaces, and everything. And sometimes I'd go to pick them up and I'd see that more than half the kids were out at the same time, all with whatever disease was going around at the time. And so I was thinking, well, maybe it's going through the air. And then I was curious, so I started reading about this, and I was surprised to read that we didn't know how much transmission occurred through the air versus touching contaminated surfaces versus like having these large droplets spray into each other's faces. And that what I did read about that was a little disturbing to me because the physics of it was wrong. They talked about this dividing line between droplets and aerosols, and it was really, they said everything larger than 5 microns behaves like this ballistic cannonball that flies out of one person's mouth and lands in someone else's eyeball. But things that are 5 microns are come out and they float around for half an hour, and they're kind of carried by the air currents in the room. They don't behave like that at all. You have to get to kind of 100 microns or more. And so I thought this might be part of some kind of misunderstanding about what was really going on.
This is the misunderstanding that you and your colleagues were coming up against with the WHO hanging on to this old concept. And like we just talked about, how you understand that your realm is out here in the air and not inside the body where the medical researchers take over, but they weren't aware of this physics and engineering aspect outside the body. But they've been hanging on to an idea. We've been dealing with the flu for probably more than just 100 years since that influenza outbreak. So we've been dealing with things like this. Wasn't there? It's kind of hard to wrap my mind around. Like we weren't aware that it's in the air floating, that people were getting sick that way for centuries.
It is mind-boggling, and so I teamed up with a historian who at Virginia Tech, who I'd known for many years because he studies the history of pandemics, and he brought in a graduate student who specialized in medical rhetoric because we wanted to track down where did this erroneous thinking come from. And it turns out that hundreds of years ago and before, people thought that diseases might be transmitted through the air in a miasma, kind of this bad air that drifted around, and things just made you sick that way. Then germ theory came along. We realized, okay, well, there are specific small things, microorganisms, that can make you sick. And kind of as part of the backlash maybe to that, they kind of really moved away from thinking that things were moving through the air. And then, there was kind of someone who had good understanding of the physics of things. And in the early 1900s, they published some papers. This is what the Wellses, and they identified kind of, well, things can either transmit through these large droplet spray that only travels a certain distance, and then other things can be airborne and can transmit farther. And then somewhere along the way, there was a public health officer named Charles Chapin who wrote a very influential book, and it really emphasized transmission by contact when people are close to each other. And he really dismissed airborne transmission, said that, it's kind of crazy, just we don't need to worry about that. And he really wanted to emphasize hand washing and cleanliness. And then kind of that really became the dominant paradigm for how diseases were transmitted, just close contact. And that persisted for decades. And then even at one point, they realized, okay, tuberculosis has to be transmitted through the air in these tiny aerosol particles because it can only cause infection if it gets down deep into the lungs. And the only particles that can reach deep down into the lungs are very small. So then they said, okay, well, we can have airborne diseases. They're transmitted by particles that are less than 5 microns in size. But somehow that became conflated with how kind of the idea of where particles deposit in your respiratory tract became conflated with how particles travel through the air. And so then this 5 micron cutoff became entrenched and defined the difference between droplets and aerosols. But in reality, instead of 5 microns, it should be more like 100 microns, and that are things smaller than that are really behave more like aerosols. And then everything became convoluted and not based on physical reality. And I think it was dominated by, well, we observe transmission mainly when people are close to each other. Yep, that's true. When you're close to a cigarette smoker, you're exposed to more of the smoke. And then, they really weren't looking beyond that. Definitions of contact tracing are for focus on people within a 6 foot distance, right? So they're not even looking for it farther away. I think if we looked more often, we'd find it.
So with some of this resistance to the message that you and your colleagues were trying to get across, tell me about some of the experiments. You must have, early on in the pandemic, it seems like it must have become important to demonstrate concretely and unambiguously that it's airborne. So what do some of those experiments look like?
Right. So some of the photos that you're seeing show some of the equipment in our laboratory. We really focused on trying to evaluate cloth masks because it became evident early on that we were going to need to, there was a shortage of medical supplies, and with universal masking recommended, we'd need to use cloth masks. So we looked at that. But some of the key experiments were done by other research groups using similar methods that we've used before for flu. One was a study that took place in China in a hospital, and they used special equipment to collect particles in the air and to separate them by size. And then they were able to identify the virus in these very small particles, the ones that really can stay floating around for hours. Another key experiment was done in a laboratory where they kind of sprayed the virus in tiny droplets, aerosols, into a chamber, and they found that, okay, the virus can survive for a few hours, which was not surprising to me because we've seen that with flu. And then finally, I'd say another kind of really key experiment was where a group collected samples in a hospital in Florida, and they used a kind of a recently developed technique for keeping the virus alive while sampling in air. So air sampling is not easy, and especially if you want to keep the viruses alive, you have to do it in a very kind of gentle way. And so they did that, and they were able to they recovered infectious virus from the air in very small particles. So clearly the virus was there in the air. Was it there at high enough concentrations that someone could be in that room breathing it in, and could potentially become infected?
If the virus is in the air, that doesn't automatically mean that it's viable and infectious, does it? So that seems like a hard determination to make.
It is, and I think a lot of people struggle with that one because we think life requires water, and that's true for bacteria and cells and things. Viruses, though, are different, and okay, we have these tiny respiratory aerosol particles that come out. I mentioned that they evaporate, and then there's this dry goo, and you would think, oh, well, if it dries out, then it can't survive. Well, viruses, a lot of them actually are perfectly happy when they're dried out, and they survive quite well. We actually kind of freeze dry them to preserve them, and laboratories do this when they're kind of storing them or shipping them around. So there's lots of studies out there, including ones that we've done, showing that viruses survive quite well when they are desiccated, or the droplets carrying them are dried out. So yeah, it shouldn't be, it's not a stretch to think that they can survive, but I guess because it had been difficult, the technique for sampling viruses from the air and maintaining that infectivity while sampling, I think that was a step that we needed to overcome, that has been overcome. There was a group at the University of Florida that had developed the sampling method over the past 10 years. We talk about it as kind of a more gentle sampling method that better preserves the infectivity of the viruses.
At the beginning, I mentioned this to you, that I've been thinking that I've really wanted to talk to you and ask you some of these questions but I suspected that this was going to be a scary interview. That because we weren't treating the virus as we should be, that it's possibly more dangerous, or at least it's following a route that we're not focused on, and we're focused on the wrong stuff. So I kind of thought this was going to be kind of scary talking to you.
Well, I think knowledge is power, and we talked about movies. So a while ago, maybe 20 years ago now, there was the movie Contagion, right? And they say there's a scene where Dustin Hoffman looks up, or somebody does. They're in a movie theater and they look at the vent and they say, "It's in the air." And so people have this idea that an airborne virus means, it's everywhere in the air. It's in our air circulation systems. It's coming down the street in clouds to come get us. But really, the virus is released by people who are sick, and again, it behaves like cigarette smoke particles. So the way I thought about it early on was, okay, I'm going to imagine that everyone around me is smoking a little cigarette, and then I can think about how the virus is moving around. I'm going to kind of steer a wider path around them to avoid that concentrated plume of cigarette smoke. I'm going to avoid being in a closed, poorly ventilated room because that smoke could build up over time, and then I'd end up breathing a lot of it.
Well, since you bring that up as an analogy, the cigarette smoke, I'm a non-smoker, and I've noticed all my life that sometimes especially on a walking path, that I can smell someone's cigarette from an incredible distance, where you see that's where it's coming from, and they're quite far away. If I can smell that person's cigarette, does that mean that I could receive an infectious dose of the virus from someone at that distance?
I think you'd have to be standing there smelling it for quite a while, because if you're at a distance, there's been some dilution that's happening. What you're smelling are actually the gases in the cigarette smoke, not the particles. But the tiny particles will move together with the gases, but our noses are very sensitive to some of those gases. So the fact that you're smelling it means, yes, some of that cigarette smoke, the gases in there have reached where you're standing and have reached your nose. There could be some particles too, but they're going to be greatly diluted. And I think it could happen. Again, you'd have to be exposed for a long enough time that you've breathed in enough of them. And I have heard of anecdotes of transmission occurring outdoors, especially if people are talking with one another close together, or if you happen to be directly downwind of someone, like you were with the cigarette smoke, for an extended period of time.
What about outdoor transmission? What is your feeling right now? Indoor is riskier, but how risky is outdoor? How likely is outdoor transmission? And
It's
does it
hard to
matter?
put.
And does it matter, for instance, if the air is really still or it's a windy day? That seems like it would be pretty relevant.
Yeah, it's hard to put numbers on it exactly, but for sure, outdoor transmission is much less likely. So outdoors, you should think of, if you can move your activity outdoors, it's going to be safer than if it were indoors. The things to watch out for are this kind of close conversation with someone outdoors, because yeah, you still get the benefit of dilution and everything outdoors, but if you're standing there talking with someone at a close distance for a while, imagine they're smoking, they're blowing that cigarette smoke right in your face, and transmission can occur that way. And there's been documented cases of transmission happening that way. The other thing is, if whether you ask whether it's windy, and yeah, that helps. Blow that stuff out of there with and get it to be diluted. Again, you want to watch out so that you're not directly downwind of someone who happens to be infected. But in general, I would say kind of wind and air movement are good, and that's true not just outdoors, but that's also true indoors, where we want the air to be moving through the space, preventing virus from building up in the air.
Sticking with outdoors for a moment, you mentioned something about humidity. There's always been these ideas like, oh, come summer, the virus is gonna disappear. It's gonna, like, what affects the viability of the virus in the air? humidity, temperature? Does ultraviolet light, how effective is ultraviolet light against it? And does that mean that seasonally there would be differences? Do we have to worry about it more in different seasons?
Yeah, those are
Yeah.
those are great questions. Everything you mentioned affects the viability of the virus in the air. So UV, we know, kills off viruses, so that's good. And sometimes that can be used indoors in high-risk settings where we have germicidal UV lights up near the ceiling. We don't want to be exposed to it ourselves, but pointing upwards, and that can kill off the virus pretty effectively. Temperature matters. Viruses, almost all of them that I know of, survive better when it's colder out. But note, we spend 90% of our time indoors, and those indoor temperatures usually fall within a pretty narrow range, kind of like maybe 65 to 75 degrees. There's not a lot of difference in virus survival in that narrow range. If you go outdoors, then that can matter. But again, transmission, I don't think there's a lot of transmission happening outdoors. Humidity does play a big role in virus survival, although there's still a lot we have to understand about that. But in general, there are lots of viruses like the flu virus and SARS-2 so far that seem to survive better at low humidity. And we have those types of conditions indoors in the winter time when it's cold out. We bring in the air, we heat it up, and then it feels very dry. Now, as for the current pandemic, I think we still have. It's so contagious. The virus is so contagious that we're not really seeing any type of seasonal effects yet. With flu, it's been around for a while, long time. People have some immunity towards it, so it's not as easy for it to transmit. So maybe it needs more ideal conditions like wintertime dry conditions. With SARS-CoV-2, it's having a field day right now, and so it doesn't seem to matter whether it's dry or not. It's transmitting. That said, I do think I do think it'll settle down, and I know I risk being wrong here. I think things will settle down maybe in a few years into a more typical seasonal respiratory virus pattern, but we still have a ways to go. And that so much has been unpredictable with this virus that like I said, I'm risking being wrong here too. But yeah,
Can you
the
give an
humidity
example?
effect is interesting.
Is there something that was unpredictable in your field, like what an expectation that you had that turned out to be wrong?
Oh, so many. Let's see. But that's what makes science fun. I think we were surprised to find, in kind of my very specific tiny area of expertise, it's been surprising to see this what we call a U-shaped pattern of virus survival with humidity. So it survives well at very low humidities and survives well at very high humidities. And I'm talking about flu virus. Seems to be true for SARS-CoV-2 and other viruses too. And then in this middle range, there's this valley of death where kind of between 40% humidity and maybe 80% humidity, where the viruses don't survive very well. But then, so that pattern has held over lots of different studies. But we went and conducted a study with my collaborator, who's an influenza virologist, and these studies are all kind of laboratory based. We went and added kind of more realistic human mucus to our virus. We had been aerosolizing it in mainly kind of these salt solutions, things that you grow cells in. When we added that, we saw no dependence on humidity at all. So it's kind of thrown my understanding for a loop, and I'm much humbler now about what we know, and we're pursuing this question and trying to understand it better about what's going on with virus survival. But an interesting addendum here is that in terms of transmission with flu, there've been a couple of studies recently coming from China and Hong Kong, where with transmission if they consider indoor humidity, which is what matters for transmission, because that's where the people are, they do see this U-shaped pattern where they see more transmission at the lowest humidities and at the highest humidities, and kind of a dip in between. And so whether that's actually related to virus survival and this similar U-shape, that's a hypothesis right now, but that could be one factor. There are other factors, of course, that play into this seasonal pattern of people's behavior and our immune system and how that is affected by seasonal changes too.
Yeah, thank you. And we did a bunch of questions and comments have come in, um, just saying that they're enjoying it, and thank you for all your important information. Um, some of these we've already covered. Ed says, like the host, I have a short trimmed beard. This makes me concerned about how good a seal, a KN95 or disposable N95 can achieve. I use an elastomeric N95, which makes me look nuts. So let me ask you it this way. Sorry. For 2 years, on social media especially, I've encountered so much mask skepticism. And often they say, and it's not usually scientists saying this, but they'll say masks don't work, the science doesn't support masking working. So I want to go into certain types of masks, and I brought some examples, but let me just ask you, do masks work, and what's the science that supports it?
I will say masks work if you are talking about reducing exposure to the virus, reducing the amount that gets into the air if someone happens to be infected, reducing transmission, reducing cases. In that case, masks work. Now, if your threshold for masks work means that they eliminate all chance of transmission, then I can't guarantee that. But there is an overwhelming amount of evidence from laboratory studies, epidemiological studies, kind of mechanistic fundamental physics understanding that masks do filter out the virus, and they prevent a lot of it from getting. If you're wearing a mask, you're worried about breathing in the virus from the air around you, the mask is going to trap or filter out or otherwise block a lot of the virus that you would otherwise breathe in. It may not be 100%, but I'll take a 90% reduction over nothing.
We still hear this confusion of people, like there are two parts to it. Like this simple cloth mask can two roles. Does it prevent me from exhaling? Does it is it good for people around me because it blocks my emissions? And does it help them as protection? Does it help the user as protection?
It
So
does
starting
both.
with something like this that I wore through the whole first part of the pandemic, is it good for anything?
It's better than nothing. I'd say maybe a cloth mask could offer anywhere from low single digit percentage to maybe 50-ish percent ability to filter out particles of the air that is passing through it. So the mask serves two purposes, really. It protects you, so it filters out particles that you might be breathing in from the air around you. And if you happen to be infected, it protects others because it also filters things on the way out. It does a little bit better on the way out just because of differences in velocity of the airflow approaching it. And because of the humidity, that keeps those respiratory particles a little bigger on their way out, so a little easier to trap. The other thing the mask does is it really, we talked about somebody smoking and the respiratory plume or jet that's coming out of their mouth. The mask just physically kind of blocks that and makes it dissipate more to the side so it doesn't travel as far. So if you're standing in front of someone talking with them, that mask is going to mean instead of my exhaled breath going straight into their face, it's not going to go as far. It's kind of going to trickle out to the sides or go a little bit, kind of halfway there maybe, but it just doesn't have that same momentum as if there were no mask.
And this isn't just your feeling. There's experimental evidence to support this.
Yeah, I've read lots of studies. Lots of laboratories have done this. My own laboratory has done this. We set up two mannequins, little foam heads, inside a chamber in our laboratory. We kind of simulated respiratory particles being generated from one of the mannequins. We used a medical nebulizer, the same that you might use to deliver asthma medication to someone. And we kind of ran some tubing in through one of the foam heads' mouths. So we drilled, poked a hole in there. So one of the mannequins was exhaling these particles, and those are similar in size to what people really emit. And then we had the opposite mannequin with a hole in its mouth also, where we put some tubing that connected to our instrument that can measure these very tiny particles. And then we tried putting a mask on one of the mannequins or the other one or both of them. We looked at different types of masks, And we know that we were able, with masks, we saw a reduction in the amount of particles that were breathed in by the opposite mannequin.
How do you detect what's breathed in
Right. So
there?
I mentioned we have this a specialized instrument to do this because these particles are too small to see. But it turns out that they are large enough that if you hit them with a laser, the laser light, we call it, scatters off of them, or kind of, you could think of it as like it's bent by them or bounces off them a little bit, and then you can kind of detect how much of that light is bounced off of them, and then okay, well, if there's more light that bounces off, then you had more particles there. You can say something about their size too, um, by how much light is bounced off, or also by kind of how long it takes them to travel between two lasers lined up. And that's one way. If the particles are really small and we can't detect them with laser light, we can actually grow them to a large enough size where we can detect them with laser light. And the way we grow them is we put them kind of into a very, called saturated, like very moist air, where the water or some other, if we use an alcohol, kind of condenses onto those particles to grow them up. This is how clouds are actually grow on little particles in the air. The water condenses on them and grows up to a larger size.
So on the other extreme from the cloth mask, the actual N95s, which have very strong straps and create a really good seal. So this is what kind of masks are you using these days? Do you use an N95?
I use a variety of masks. It depends. If I'm in a higher risk scenario, if I'm in a crowded indoor environment for a while, if I'm traveling on the airplane, I wear, I also have my N95. I have kind of a softer shaped one that I find very comfortable. I've worn it for 12 hours at a time. It's surprisingly easy to breathe through. When I first got it, I was like,
Right.
oh, wow, this is so much easier to breathe through than a cloth mask. Um, and
That's
it's very
interesting. That's an
comfortable.
N95. I have something with a similar shape that I got in Germany, and it's not labeled as KN95 or N95. I don't know if that means anything to you.
Can't tell. That one looks
FFP2,
like FFP2. That's the European standard, which is similar to an N95, although it
but
has
I've
ear lip
liked
straps.
it
That's
forms a
the
really good seal here. And that question from Ed, it actually does a really good job against my neck. It may not be completely airtight, but it feels more so than some others.
that's the boat style one, which if you find the KF94s, the South Korean version, they all come in that boat style. And in terms of the fit around the chin, I've tried different kinds, and I find we all have different shaped faces, and the mask and N95s come in different. They kind of, some fit
Yeah,
certain types of faces better than others. So you may need to try different kinds, and you'll find I had one that was just kept slipping off my chin. It was too big. It was annoying. So I tried some others, and that worked well. And if you do have a beard, right, you'd want to kind of keep it trimmed enough so that you can still get a good seal. If you have a big bushy beard, that's not gonna that's a challenge to get you really can't get a good mask fit with that. But
right.
pandemic facial hairstyles would be kind of keep it inside your mask so you can still get a good seal on the
You're
outside.
so as an environmental engineer, you're as an environmental engineer, you are recommending the goatee as a fashion statement.
The maybe the short goatee. I think the mustache, kind of keep it narrow here and not long. Right, that
Mark
would be
shaved off
fine. So
most of
yes.
his beard at the beginning of the pandemic. Um, Regina says she's undergoing cancer treatment and using a tight fitting N95. Um, what are Have you, in terms of other changes, what about at the beginning of the show? I mentioned architectural changes, ventilation, airflow. Do you have a vision for of changes that you would like to be implemented more commonly?
Yeah, absolutely. I think we haven't really thought much about our indoor air quality. It's just kind of there. We think about our water quality. So if you were given a glass of water to drink and it were kind of dirty and things, you probably wouldn't drink it. But we're just not used to thinking about indoor air quality. There's rules and regulations for outdoor air quality. But again, we haven't done much about indoor air quality, but that's where we spend 90% of our time. It affects our health. It affects our ability to do our work. And my vision is that we have healthy indoor air quality that allows us to be our best selves. So it's not detracting from our ability to pay attention and to be well and to avoid asthma. And so that means that we have air that is free of pollutants that harm our health. And that's not just viruses, but it's also other types of particles. There's certain gases that are bad for us. So what do we need to do? Well, right now, a lot of buildings are optimized for energy savings, which means that we recirculate the air because that helps cut down on heating and cooling costs. We don't have to keep bringing in outdoor air and heating and cooling it. But I think it's time that we need to rethink that model and consider not just energy savings, but also our health when we think about moving air through our buildings. And so that could be, well, if the air quality outside is good, that means bringing in more outdoor air rather than just having the same recirculated stale air. There are treatment systems we can use, like filters, to filter out particles from the air. I see you're showing one of the Corsi-Rosenthal boxes, which is has been shown to be a really high-performing filter way of removing particles from the air, not just the virus, but also other particles. If you live in wildfire country, probably this would be good to have during wildfire season.
Tell me about this, because it's called a Corsi-Rosenthal box. You can get plans online, and you can see it's very simple. I mentioned it to a friend of mine, and she made, like, within a day or two, using a fan she already had. She went to one store and got some filters and taped it up and made one at a total cost of $50, $60. She already had the fan. But are these effective? Are these useful? I've seen little tiny ones and bigger ones. Is this something you recommend, and do you envision this becoming a more common sight?
Yeah, I definitely recommend these. I mean, what you do is you take a box fan and then you have some filters around the sides. I think people have been using MERV 14 filters ideally. So MERV refers to the rating of a filter, how well it filters out particles. You can use HEPA filters, but that's going to be harder for the air to move through. So you still get very good performance with the MERV 14 filters. You get 4 of them, you set them up kind of as the walls, and you put your box fan on top. And the air that gets pulled through the filters and then by the fan exhausted upwards is going to have most of the particles removed from it. And I've seen colleagues have been testing these, and they perform really well. So your other alternative is to go out and buy a portable HEPA air cleaner for maybe $200 or $300, and this performs better than those, and it costs less.
Oh, really? Oh, no. Oh, this performs better than the one you could buy.
Yes. So one thing to think about is, okay, you think, oh, I'm going to go get a portable air cleaner. It's HEPA, so that's the best. This Corsi-Rosenthal box, maybe you've made it with a MERV 14 filter, not a HEPA filter. But this box moves more air through it. And so that air, once the air passes through there a couple of times, 2 or 3 times, it's performing like a HEPA filter in terms of what we call the clean air delivery rate. So these Corsi-Rosenthal boxes give you more clean air than the $200 or $300 portable air cleaner. Now you can go spend more on a portable air cleaner, $600, $1,000, and you can probably get more similar performance. So noise might be a consideration also, and filter replacement costs. But overall, these boxes perform very well.
Excellent. Well, Linsey, I know we're about out of time, and I thank you for spending this much time talking to me about this. Do you feel like you're very active on Twitter? You share a lot of important information. You have quite a big following. Do you feel like the communication is a part of your job beyond just your research?
Yeah, I think it became a part of my job starting 2 years ago because of the amount of misinformation out there and dogma, frankly, that was out there about virus transmission. Even early in the pandemic, there was really this emphasis on droplets, and 6 feet is enough. If you stay 6 feet away from someone, that'll help. But I knew that was incorrect, and I was really one of a small number of people in the world who I think had a more accurate understanding of transmission. So I felt like it was important for me to get that out there. Otherwise, we'd still be just talking about 6 feet and thinking that would be enough and wondering why is this virus spreading like wildfire. So yeah, I became more active on Twitter, have done lots of media interviews to try to get the right information out there scientifically about how virus transmission works and to the public about how they can best protect themselves.
So there's so many parts of this. I want to ask you what in terms of communication, what you want us to know? Are there any big misconceptions, or what are some of the most important messages you want us to know? And I wonder if we talked about ventilation, we talked about cleaning the air with something like a Corsi-Rosenthal box. We touched on ultraviolet. Is that something that could also work inducting? I mean, obviously, we don't all want to be bathed in ultraviolet light all the time, but is that an important piece of the puzzle?
Yeah, I think the biggest message I have is that we've spent a lot of time talking about 6 feet and washing our hands and cleaning surfaces, and I would say we really need to focus on cleaning the air. That is going to give us a lot more bang for the buck in terms of reducing transmission, protecting people's health. As far as UV goes, there are some systems that can work in ducts. I think they have to be properly installed, because if the air just whooshes by there for a second or so, it's not enough exposure time to kill off any virus. But a bigger concern is really kind of what's happening in the room, and having good air quality in the room so that you are preventing virus from building up in the air, whether that's by having good ventilation, or good filtration, or maybe a combination of both. And with that, those things, doesn't mass help also. Really, all these things are complementary. But I do hope that in the long run, any attention we pay now to improving our indoor air quality will have benefits in the long run for other viruses, and also just for our general health, for absenteeism, students' performance, academic performance, behavior, asthma. There's many, many benefits that we can reap from paying more attention to our indoor air quality and making sure we have cleaner air to breathe.
Well, excellent. And thank you so much for taking the time to talk to us. Dr. Linsey Marr from Virginia Tech, you can find her. She's an environmental engineer and has a great Twitter presence at Linsey Marr. So go check her out. Thank you, Linsey. And that is our show. I'm sorry. You know what? We had a lot of great comments and a lot of great questions. Couldn't get to all of them because I'm so long-winded. Even in the age of COVID, I guess I'm long-winded. But thank you so much for tuning in and sending in your comments and questions. On Wednesday, we're going to have a really fun show with Kimberly Arkan. She's a visualization scientist that works on the Chandra X-ray Observatory. Our theme music is by Logan Whitehurst. Check him out at loganwhitehurst.com and check out his artist page on Spotify. Once again, I'm Brian Malow. You can find me at Science Comedian. Thank you, everybody.